Welcome to the beginning of our course, Unlocking the Secrets of Chronic Low Back Pain. Let's start off with Module 1, where we do a general overview. And let's talk about your instructor, myself. A little bit about me. My name is Dr. Albert Lai. I'm a physician that has been treating patients with chronic pain for over 19 years. I've treated well over 5,000 patients. I completed my medical training at Tufts University, where I subsequently served as a clinical instructor. I've been board certified in physical medicine and rehabilitation. I'm also board certified in pain medicine and addiction medicine. My goal is to achieve maximal restoration of physical, psychological, social, and vocational function of chronic back pain through a comprehensive rehabilitation without medications. My professional interests include interventional pain management, neuromusculoskeletal disorders, and regenerative medicine. My approach to caring is based on improvements in quality of life through improvements in function. We have a saying in my office: life begins when pain ends. Uh, Here's some big goals that I want you to take home for this course. Understand what is chronic pain, understand the anatomy of the low back and how it works, and then to be able to identify and be self aware of what is actually causing your pain. And then you learn about all the available treatments that are available. Hopefully, by the end of this course, you'll be able to live without the dependence on medications and also have direction in determining your own care. So, in the continuation of Module 1, we're going to be doing Lesson 2 now, and that's talking about chronic pain syndrome. Let's talk about chronic pain in general. There is a condition when pain becomes persistent. Chronic pain syndrome is a condition characterized by persistent or recurrent pain that lasts longer than 3 months or longer. It's complex, it's multifactorial, it comes from potentially a lot of different sources. It results from a variety of physical, psychological, and or social factors. It is basically when your nerves short circuit and the one pain signal sends back another signal for more pain. It becomes a vicious cycle that doesn't end on its own. So, what eventually happens is pain itself, the pain signal itself, causes even more pain. Pain begets pain. When the body has rewired itself to constantly think about pain, and it then creates a feedback loop that doesn't necessarily directly involve an injured area. The pain signal continues to go from the brain to the spinal cord and back to the brain. So you really don't even need a pain stimulus, meaning like a cut on a finger, for it to cause pain anymore. The pain signal, okay, starts to send other signals back on itself so that the pain cycles. It becomes this vicious cycle, like we're talking about. So it's basically a pain that persists without even a stimulus to be had. Common causes of chronic pain syndrome include injuries, surgeries, autoimmune disorders, nerve damage, fibromyalgia, chronic fatigue syndrome, psychological factors such as depression, anxiety, stress can all be causes of chronic pain syndrome. Symptoms of chronic pain syndrome, it could vary from person to person, but it can include persistent or recurrent pain, obviously, fatigue, sleep disturbances, mood changes, can cause depression, anxiety, cognitive difficulties. It can cause impairments such as uh, issues with your memory, difficulty concentrating, reduced mobility, or difficulty with even your daily activities. It can then cause social isolation and decrease participation in your normal day-to-day activities. There are several potential mechanisms, okay, that can lead to chronic pain that we have proposed. Uh, Two of them is central sensitization and peripheral sensitization. In peripheral sensitization, this occurs when there is damage or inflammation in the peripheral nerves, okay, or in the tissues around the nerves. This leads to increased sensitivity and responsiveness to pain signals. The second one, central sensitization, this occurs when there are changes in the spinal cord and the brain that result in heightened pain sensitivity and altered pain processing. This can lead to chronic pain even in the absence of ongoing tissue damage or inflammation, as we talked about. So you have peripheral and then you have central. Central meaning it's in central nervous system, that's the brain and spinal cord, okay? Or it can be on the outside, in the periphery, which are your extremities and in your trunk. There are different types of pain. One is neuropathic pain. This is a type of chronic pain that caused by damage or dysfunction of the nerves themselves, such as cases with the peripheral neuropathy, which is pain in the extremities, especially the outer parts of extremities, your fingers and your toes, and can move on in, or spinal cord injury. There's inflammatory pain. That's inflammation that can cause pain by sensitizing pain receptors and promoting the release of the inflammatory molecules that stimulate pain signaling. Obviously, structural abnormalities, physical changes such as a herniated disc or disc degeneration or joint or disc degeneration can cause chronic pain by compressing the nerves or causing ongoing tissue damage and inflammation. So, next lesson in Module 1, where we're still in general overview, but let's talk about now chronic back pain. We talked about chronic pain syndrome in general. Now let's get a little more specific and talk about chronic back pain. So low back pain is a very common condition with about 80% of people experiencing it at some point in their lives. There are many reasons why low back pain is so common. This includes poor posture. Many people have poor posture. This really causes strains, okay, on the muscles and ligaments, okay, and puts pressure on the joints of the back. This can lead to pain. Lack of exercise. So lack of exercise can cause the muscles to weaken, yeah, around the back and the core, which can make it more susceptible to injury. Sedentary lifestyle. People who sit for long periods of time, such as office workers or truck drivers, are at high risk of developing low back pain. Obesity, being overweight or obese, can cause additional stress on the spine, which can lead to pain. Aging. As we age, discs in our spine start to degenerate naturally. This can lead to pain and other issues. Poor lifting technique. So poor lifting of heavy objects with a technique that is with a technique that might put additional pressures on the spine. Well, obviously this can cause excessive strain on the back, leading to pain and injury. Genetic factors. Some people may be more prone to developing low back pain due to genetic inheritance. People talk about, how their parents, their mom or dad, has had back pain. Well, that might have some contribution to why you have back pain. Statins. There are drugs which can be used to lower cholesterol levels and can cause muscle pain and weakness. That can affect the muscle of the back and contribute to low back pain. There's other medications as well that we'll talk about in the later modules that can cause it, but that's just one example. Okay. Um, Low back pain in general is a very complex condition with many contributing factors, as you can see. But it's very important that we address these underlying causes in order to prevent and treat effectively. Acute versus chronic back pain. So let's dissect and determine if all pains are equal or not. They are not, obviously. Let's distinguish between acute and chronic. Back pain can be classified in these two categories. Okay, acute pain is a sudden and short-term pain that usually lasts less than 3 months, but usually a few days to a few weeks. This back pain is um, caused by injury, poor posture, lifting heavy objects improperly, sudden movements. Okay, it's caused by um, these injuries that can be treated, and they can be treated with maybe some rest, ice, um, over-the-counter pain relievers, and it usually resolves on its own with the help of some of these short-term remedies. So that's the typical pain that we get over, okay, and that's the pain that we usually hope we have when we do develop this low back pain. But unfortunately, there is another type, and that's chronic pain. This may be caused by a variety of other factors, including the chronic pain syndrome that we talked about earlier, degenerative disc disease, spinal stenosis, arthritis, so structural changes can cause it. Um, it generally requires more than just the help that you get with acute pain, the ice heat, the short-term medications. It requires a comprehensive medical evaluation and treatment plan. We talked about how prevalent low back pain is. 80% of adults will experience pain in their lives. Okay. In a global study that was published in the Lancet journal in 2018, it stated that low back pain was a leading cause of disability worldwide. Okay, it affects around 540 million people at any given time. It obviously increases with age, and they found that it's actually a little more common in women than men. There's another study that shows how back pain it's such a burden on the workforce because it's such a cause of disability worldwide, and that's in a global burden of disease study. Mm. Chronic back pain can affect cognitive function that leads to problems with memory, attention, concentration. People with chronic back pain are more likely to suffer from depression and anxiety. Um, the use of opioid pain medications for chronic back pain has become dramatically increased in the recent years. And that's some of the maybe news stories you've heard of on some of the issues with the pain medication and how it's affected people and their families. Um, there's also increasing awareness now that the safety and effectiveness of these opioid pain medications may not be as good as we've learned in the past. So times have changed. Chronic back pain can obviously lead to decreased mobility, which can in turn lead to weight gain, which further exacerbate pain. This spiraling vicious cycle, okay, of chronic pain. That's what we're talking about. Some studies have suggested that certain psychological factors, such as catastrophizing or fear avoidance behavior, may play a role in the development and persistence of chronic back pain. So, obviously, underlying psychological factors can obviously contribute to the chronicity of pain. Back pain is often associated with poor sleep and insomnia as well. So, again, that vicious cycle. If you can't sleep, then you're going to have problems with healing your body, restoring your body. And then if you keep at it, it's going to continue to weaken your body. And then that will lead, obviously, to more pain in the future. Let me tell you about a case study, a patient that I've had, Debbie. Debbie has been suffering from chronic low back pain for well over 15 years. And when she presented to me, she came in using a walker, barely using a walker. Uh, and she had to get assistance getting up and down. She came with her personal assistant that actually needed to uh, uh, help her get up and down, carry her purse. So when she presented to me, she was on heavy doses of pain medications already, and she's been on it for years. She had multiple even treatments before. She had spine surgery before even, and obviously physical therapy and some other conservative treatments. She was thinking about suicide. She was at her wit's end. Okay, she had lost all hope, and she was convinced that no one could help her, and all she needed was just give me more meds, doc, because that's all I need to get by from day to day. She really didn't want to listen to what I had to say, and this occurred over several visits. Um, all she wanted was her med refills. After about 6 months or so, she um, uh, started listening to some of the things I had to say because it was a little bit different. I tried to approach her case in a more comprehensive manner and talk about her and exactly what her issues were. She started gaining a level of trust with me. I discovered that one of her primary impairments was her sacroiliac joint. Um, Sacroiliac joint, as we will discuss in the future lectures, is a joint that's located actually below the lumbar spine, below the low back. But a lot of people consider it the low back still. She then started taking some of the advice treatments that I recommended. This included a specific physical therapy regimen for the sacroiliac joint and some injection therapy. After about 6 months of this, um, she started um, uh, coming into the office with less dependence on a walker. And one day she actually walked in with just a cane. She didn't use her walker at all. She actually didn't have her assistant anymore. She actually told me that she actually stopped her regular pain medications and was free from needing it like clockwork. Um, with a lot of pain patients on chronic pain medications, you actually have a watch and you actually keep time to exactly when you need your next medication, your next dose. She didn't need that anymore. So this was a great success story. This is what keeps me going. This is kind of what I want to hear that hopefully you will encounter as an experience in the future. So let's get to the next lesson. Welcome to another module in unlocking the secrets of chronic low back pain. We're going to move on from our general overview in module 1, and now we're going to talk about module 2, in which we're going to go over the nuts and bolts of the back. We're going to go over the anatomy, the physiology, and the pathology. Lesson 1 is the anatomy. So the lumbar spine consists of 5 vertebrae, okay, the bones of the spine, and they're labeled L1, L2, L3, L4, L5. So there's 5. There's 5 vertebrae, and they're located in the low back, in which between the vertebrae are your disc, your lumbar disc. Okay, and they play a crucial role in obviously the stability, the cushioning, the flexibility of the spine. The lumbar spine is also known as the low back. Okay, is the region of the vertebral column. Okay, so this whole long spine of ours. Okay, it's the lower part of your spine. Okay, and it's located between the thoracic spine and the sacrum of the spine. Okay, and the vertebrae, which we already know have contained 5 vertebrae, L1, 2, 3, 4, and 5. Okay, gradually these bones actually increase in size. So L1 is smaller than L2, and L2 is smaller than L3. L5 is obviously the largest one. So the lumbar spine is obviously in the lower part of your spine, so it has to support a lot of body weight, right? So um, this also they have to support not only this weight but the motions of your body. Okay, so this includes bending, twisting, lifting. Okay, so that's the reason why the lumbar spine is also considered the fulcrum of your body. Everything pivots around the lumbar spine. That's the reason why a lot of forces are being applied to the lumbar spine. And that's unfortunately the reason why a lot of people have lumbar spine pain. So let's talk about the general look of the spine. Okay, this includes some of the natural curves of the spine. The spine is not stacked straight up and down like a tower of building blocks. Okay, there's actually curves to it. Okay, and it's natural. So there are 4 primary curvatures in the human spine. Okay, the first one being this. Let's take it from the top, the cervical spine, and there's a cervical curve. Okay, and this cervical curve is located in the neck region, and it's concave anteriorly. This means that it's curving towards the front of the body. Okay, so it's curving towards the front of the body. And this consists of 7 bones, okay, 7 vertebrae. And this curve is known as the cervical lordosis. Lordosis, this curve where it's concave anteriorly, is what we uh, termed because back in the day when we had lords, the lords would have a particular walk, right? They would be having this boastful chest, okay, in which you had this outward um, curve that faces you. So this is why we have this outward curve of the cervical spine called cervical lordosis. As we move down from the cervical lordosis, we have the thoracic spine. The thoracic spine is part of the mid-back, which consists of 12 vertebrae, and it actually curves the opposite direction of the cervical spine. So it's convex anteriorly. Okay, so it's convex. Okay, it's open to the front, and um, this this is what we call kyphosis. Okay, so there's a cervical lordosis and there's then a thoracic kyphosis. And as we work our way down from the thoracic spine, the next section is the lumbar spine. So in the lumbar spine, the lumbar curve is it's concave anteriorly. Okay, and so it's concave anteriorly, much like the cervical spine. So it's called a lumbar lordosis. Okay, and this lumbar lordosis then continues on and it turns the other way and to in the next section of our spine, which is the sacrum. And the sacrum is formed uh, not and from actually it used to be 5 bones when we were developing as an embryo, but as we developed, we actually fused these bones together. So in a normal adult spine, it's actually 1 bone formed from 5 bones. So it's all fused. And so there is a curve to the sacrum, and that curve is convex anteriorly, much like the thoracic spine. So we have a sacral kyphosis. Okay, but as you notice, these are natural curves. Okay, that come from the neck all the way down. So it's this windy kind of S curves, and it actually is there to provide stability of the spine, and it contributes to the upright posture of the spine. It absorbs the forces being applied to the spine during various activities. Um, these combination of these curves allow the spine to actually distribute forces um, more evenly, and it can then uh, absorb these forces and distribute the stress that you're putting on the spine to help reduce, obviously, injury and promotes the overall spine health. Let's go over some of the basics of what makes up your spine by looking at the overall shape of the spine, right? Just so you get the orientation down. When we see pictures, then you have an idea of exactly where we're looking at, how we're looking at from the front, from the back. But obviously, the lumbar spine, okay, in the low back is connected on the upper by the thoracic spine, in which your thoracic spine has all the ribs. So your rib cage is above your lumbar spine, okay? And then below your lumbar spine, you have your pelvis, right? And the pelvis is made up by several bones, okay? Obviously, the first one being the sacrum of your spine, right? But that's connected to the pelvic, okay, region by the pelvic bones, okay? And that is connected lower down below by a joint, the hip joint, okay? So these are a couple of pictures, front and back side, that you can see the overall shape and look and the curves. So by familiarizing yourself by the look at things, it will help you better understand why it works the way it works. So let's go over some of the major structures outside the vertebral bodies. Okay, and so outside the vertebral bodies, the bones of the spine, they are connected to each other by connective tissue. Okay, the connective tissue that connects one bone to the next bone in our bodies are ligaments. So we have a lot of ligaments that connect all these different parts of your vertebrae in your lumbar spine. So we don't have to go over and belabor each ligament, but each ligament has its own purpose. And sometimes these ligaments can be disrupted or can cause issues that contribute to the pathology of the spine. So just know that there's a lot of ligaments in our body, especially in our lumbar spine. So the the disc are is the soft tissue that connects one that is wedged between one vertebral body to the next vertebral body, and the disc contained two components. The first component is the annulus fibrosus. Okay, the annulus fibrosus is the outer layer of the disc. Okay, and it contains a lot of fibrous cartilage. The annulus fibrosus is formed as concentric rings around the center. Okay, these concentric rings are collagen fibers. Okay, and its primary function is to provide structural integrity to the disc. Okay, it's tough. Okay, these concentric rings I always allude to as like rings of an onion. Okay, very similar, and it's surrounding a jelly-like center, which is called the nucleus pulposus. Okay, the nucleus pulposus is the inner core of the disc. It's in the center, and its jelly-like substance is made up of primarily water, and then it also contains some proteoglycans and a network of collagen fibers. But its main role is to absorb and distribute the forces that are acting on the spine. Okay, it's kind of like the shock absorber for the spine. It also obviously is soft tissue, so it contributes to flexibility and mobility of the spine. We already talked about this component, the bones of the spine, which are called the vertebrae. Okay, the uh, the vertebrae, the five vertebrae, as we know, L1, 2, 3, 4, and 5, okay, are very unique structures, okay, in itself, each one, but they share similar characteristics, okay. The vertebral bodies of the vertebrae are cylindrical portions that bear weight from the upper body, right? So the vertebral body has bony arches that formed around in a circle that form a circle which is containing the spinal canal. Okay, the spinal canal is where your spinal cord lives, and your spinal cord is the nerves that come from your brain. So it has a very important function in that the vertebrae protect your spinal cord from injury, okay, with a bony cage around it. But the vertebrae, um, as we said before, are different from L1, 2, 3, 4, and 5 based on how much weight each vertebrae bears. So L5 is a bigger bone than the L1 vertebrae. Um, Another aspect is you have one bone that connects to another bone. The way it connects is through a joint. Okay, the joints of the spine are called facet joints. The facet joints are small joints located in the back aspect of the vertebral body. Okay, we call it the posterior aspect. Okay, and they connect one adjacent vertebrae to the next. And this joint allows for smooth movements and stability of one bone next to the other bone. Um, the facet joint is much like every other joint, like a knee, a hip joint, shoulder, in that the two bones have surfaces that have cartilage. Okay, the cartilage of each joint allows for the smooth gliding, okay, against each other. It enables the bending, the twisting, the extension of the spine via this joint. And just to note, another part of the vertebrae is the spinous process, okay, because we can feel this part of our spine. These are the bony projections that extend backward, okay, from the back side of our vertebrae, and it's what we feel. That's when, if you run your fingers down the middle of your back, the little bony prominences that you feel is the spinous process. Okay, it's important again because a lot of ligaments attach to it. It's an anchor point to your spine. So it's important to note this because as we talk about pathology, disruption of these particular ligaments at this level can cause problems for your back. Again, to go over spinal ligaments, okay, it's actually a very important aspect of your spine. That's why I put it in here a couple times. Um, but it supports and stabilizes the bones of your back. Okay. There are several of them that are important that we don't need to really go over at this level of learning. But it's nice to have these pictures because suppose you have an MRI which actually discusses specific anatomy of your back. We sometimes mention the specific ligaments. So the specific ligaments are all here. So you can refer to these pictures at a later date to see exactly what the MRI reports are actually talking about. And surrounding the bones and ligaments of the spine are your muscles. And the muscles of the lumbar spine is a network of muscles. Uh, there's a lot of them. Okay, and these muscles is what we call make up what we call the core of our back. Right, when you call core strengthening exercises, we're talking about these particular muscles. Okay, there's muscles like the erector spinae muscles that run up and down the whole spine and connect multiple levels. Okay, not just your lumbar spine but to your thoracic and to your sacrum, so they run vertically. Okay, there's deep muscles like the multifidus. Okay, that assist with stability and control movements, okay, that run all the way down to your hip. So they are very important in the lower aspect of your spine. And lastly, we don't have anything unless we have a fuel supply to all these tissues of our back, and that's the blood supply. And the blood supply is important in that you can see that all this blood flow goes to a lot of tissue area, including your disc. So if the disc age and the blood supply decreases, that can lead to degeneration of the disc. And remember, the disc center is mainly made out of water. So as you dehydrate, it flattens out. And so if you don't have proper blood supply to the area, it'll further degenerate the disc and cause you to even have a larger, flatter tire. And that can obviously cause issues. Okay, so we finished the anatomy, then we finished the physiology. Now let's talk about when things go wrong, or we call it pathology. So let's talk about the pathology of the back. Um, there are several potential underlying causes or pathologies that can contribute to chronic low back pain. A herniated or bulging disc in the lower back can put pressure on the nearby nerves, causing pain, numbness, or weakness in the lower legs um, and back. There are different types of disc herniation based on the shape of it. A healthy disc should have a contained jelly-filled center that the nucleus pulposus has in the center, surrounded by the intact fibers of the annulus fibrosus. If there is degeneration of the disc, the shape changes. This will lead to structural loss of integrity of the fibers surrounding the disc. This will then lead to the jelly-filled center to start protruding. When it protrudes, it's called prolapse. This is a disc bulge. Okay. The disc bulge can rupture the ring of the fibers of the disc. Okay. The contents of the disc will spill out. This is then called an extrusion. This is similar to a popped balloon or tire. The picture has misspelled, just to note, has misspelled the word extrusion. Um, Lastly, the expelled contents can sometimes be free floating outside the disc. This is called sequestration. There's another one to note is when you have tears of the annular fibers, right? The collagen fibers that surround the disc. If there are tears in that, that can sometimes be noted, and an MRI can pick it up. And that's called an annular tear, a tear of the annular fibers of the disc. So annular tear is something that you can note. That in itself can cause pain in itself. This degeneration is a natural process, right? It happens to all of us because of dehydration of the disc. Um, and but the problem is it could be accelerated. And some of the things that can accelerate the disc are genetic factors. Genetics, people may inherit genes predisposing to disc degeneration. Um, this makes them more likely to experience it at a younger age or more severely. Mhm. Age-related changes, that's what we talked about, in that you lose with the water content. Um, and when you lose water content, it's like the tire flattens. And so when it flattens, it could make them less flexible and then more prone to degeneration. Um, Trauma. Obviously, trauma with a severe injury can cause issues like disc herniations or bulges. Poor posture. If you have poor posture, especially for long periods of time, that can put additional stress on the disc and other structures in the spine that leads to degeneration. Lack of exercise. So exercise helps maintain a health and flexibility of the disc. Um, it with the lack of it, well, then you have decreased strength in the muscles that surround the spine as well. So that will obviously lead to more instability of the spine, which leads to accelerated degeneration of the disc. Smoking is an issue. Smoking has been shown to decrease the flow of nutrients and oxygen to the disc. This will accelerate the degeneration. Basically, you're starving the disc. Obesity. Obesity, being overweight, can cause additional stress on the lumbar spine, especially the disc. That accelerates the wear and tear of the disc. Nutritional deficiencies, the lack of certain nutrients like vitamin D, calcium can contribute to disc degeneration as well. Now you're starting to might get familiar with some of the processes that are happening in the spine, including degenerative disc disease, right? So degenerative disc disease occurs when the discs between the vertebrae of the spine degenerate or wear down, and that can cause pain and stiffness in the lower back. Um, you can see here a progression of the degenerative disc disease from left to right. As it progresses, you see that the discs start flattening out, thinning out, right? They start dehydrating, flat tire, okay? Now, as you can see, if the tires wear down and flatten down, it starts hitting other structures, and the other structures start getting affected. So in degenerative disc disease, it's not just degenerative disc disease. It also involves the bones between the discs, okay? As you can see formation of bone spurs in the picture here. You can also see that the joints, well, not on this picture, but in the backside, the joints will start rubbing against each other, and that will cause arthritis of the facet joints. So it's an overall process that affects the whole lumbar spine just because of one disc degenerating. Um, Again, another picture to illustrate the pathology. We see progression from top to bottom of degeneration of the disc. Here you can see the degenerative facets in the backside of the spine on the bottom of this picture. Spinal stenosis. Stenosis means narrowing. When you can have narrowing of anything, you can have narrowing of your heart arteries. That's called coronary artery stenosis. You can also have narrowing of your spinal canal. That is called spinal canal stenosis. You can have spinal stenosis of your lumbar region. So that's called lumbar spinal stenosis. In this picture, you can see a healthy spine with a normal spinal canal on the left side of the picture. On the right side of the picture, you can see that there are several things causing narrowing of the spinal canal. The canal meaning the what's highlighted in yellow. And so you can see bulging discs bulging into the spinal canal. You can also see bone spurring that is bulging into the spinal canal from the other side. So then overall, you see this squeezing, this narrowing of the spinal canal. And remember what's in the spinal canal? Your nerves, your spinal cord. So what happens is you have spinal stenosis that narrows down the spinal canal, and then it starts affecting the nerves by pinching them off. You can think of the spinal canal much like a garden hose, where if you have spinal stenosis, you get a kink in the garden hose. When you have a kink, the flow of the water decreases. The same goes with your nerves. So that's the problem with spinal stenosis. Here's another picture that might further illustrate the problem. This is spinal stenosis caused by a disc bulge. And you can see that it's narrowing down the opening where the nerve exits, and that can cause a pinched nerve to occur. The pinched nerve will cause symptoms like radiating pain down the leg, numbness and tingling in the legs, what we call sciatica. The facet joints, those are the small joints, okay, that are highlighted in red here. That's located between the vertebrae, between each of the vertebrae of the spine. They can become irritated when they start degenerating, and that can cause pain and stiffness of the back. This is probably a good time to talk about arthritis. Not all arthritis is created equal, and there are particular ones that are more preeminent in when we talk about chronic low back pain. Rheumatoid arthritis, okay, which is depicted on the left hand of the chart, is an autoimmune disorder. Okay, that's when your own body attacks your own connective tissue of the joints. Osteoarthritis, depicted on the right hand side of the chart, is a degenerative disease that affects the cartilage and the bone surface. Osteoarthritis, not rheumatoid arthritis, causes most of the issues of the lumbar spine. Okay, there is a caveat in that there are autoimmune arthritis that do affect the spine. One example is ankylosing spondylitis. But for the vast majority of arthritis of the spine, when people discuss that with you, it's generally speaking osteoarthritis that we're talking about, and we're talking about a degenerative disease. We need to note that the low back pain is not the only cause of lumbar spine issues. Okay, the SI joint is a cause of chronic low back pain. Pain or discomfort in the lower back or buttocks, okay, can be caused by this particular joint. Okay, this joint, remember, is the union between the sacrum of the spine, the bottom of your spine, and the pelvic bones. Okay, the iliac crest of the pelvic bone, and so that's called a sacral iliac joint. It's a union between those two, and they're two, one on each side, long, very narrow joints. Okay, but they can get affected much like any other joint can get affected, and you can see that they sit below the lumbar spine, but it's close enough that it can represent low back pain. It can usually cause pain or discomfort in the lower back. It's worse by sitting, standing, or walking for prolonged periods of time. It can cause a lot of stiffness of the back. It is worsened by activities that involve twisting or bending of the lower back. The pain can sometimes radiate down the legs, okay, but it's usually not associated with numbness or tingling. Strain or sprain, okay, in the muscles or ligaments in the low back can cause pain and stiffness, especially with movement or activity. One particular muscle of importance is the piriformis muscle. This muscle ties the sacrum of the spine to the hip joint. It is of interest because the very large sciatic nerve that starts in the lumbar spine and runs down the length of the leg sometimes pierces the piriformis muscle or is adjacent to the piriformis muscle. So when this muscle is particularly tight, it can affect the sciatic nerve, causing pain. The pain or discomfort is usually in the buttocks. It's worse with sitting or standing for prolonged periods of time. The pain can radiate because of the sciatic nerve down the back of the leg. Numbness or tingling can happen because of the possible pinched sciatic nerve. You have difficulty walking, standing up straight. The range of motion of your hip could be affected as well. Osteoporosis is another pathological disease that can affect your back. This is a condition which causes bones to become weak and brittle. Okay. When the vertebral bodies have osteoporosis, it can lead to weakening of the structure, right? And remember, the lumbar spine has a lot of load on your body, and so the compressive forces that are being applied to this bone can shatter because it does not have the structural integrity that it has as it does normally, and so that fracture will cause a lot of pain. And this is another example of a picture of a compression fracture. So you can see that if the bones are brittle, it can fracture. There's another condition in the spine that causes pain, and that's called spondylolisthesis. So this is when one of the levels of the vertebrae of the spine slips out of place and basically moves sideways, and because of that, it can cause uh, pressure and narrowing in the spinal canal, and that can then pinch nerves off. It can also cause pressure onto the joints of the spine, and sometimes can cause a fracture of that joint. So that will cause a lot of pain, especially when you're standing or walking. And psychological factors such as stress, anxiety, depression can contribute to chronic low back pain. Um, it, um, they can also be associated with muscle tension and increased sensitivity to pain in itself. Welcome back to Unlocking the Secrets of Chronic Low Back Pain. And We went over 2 modules so far. The first module, a general overview, and the second module being anatomy, physiology, and pathology. Now let's, in this module, go through various scenarios when pain may occur the most and discuss what could be going on in the back. We'll talk about pain while sitting, standing, walking, lying down, when bending forwards, backwards, and lifting. The first up is when you're having pain while standing and walking. A very common issue is poor posture due to weak muscles causing muscle strain. This is a very important reason why you may have pain while standing or walking. Herniated disc can occur when the soft inner material of the disc pushes through the crack of the outer layer, putting pressure onto the nerves, causing pain that may be worse when bending forward. This is what we call discogenic pain, pain coming from the disc. A type of discogenic pain is a disc herniation. We have seen this diagram in the previous module. It shows the different types of disc herniation. Spinal stenosis. Remember this? This is a condition that may worsen pain while standing and walking. This condition occurs when the spaces within the spinal canal get narrow and puts pressure on the nerves. That causes pain, and the pain usually occurs throughout the day. There is a well-known sign of spinal stenosis. It's called the shopping cart sign. I would ask patients if when they have to bend over and use the handlebar of a shopping cart while walking through the store, if they say yes, this is a sign of spinal stenosis. And this happens because while you have spinal stenosis and it crips down the nerves, when you flex forward, it actually opens up the spinal canal, just that much, enough to maybe alleviate the pain and pressure that's being put on the nerves. Another pathology that can cause pain while standing and walking is spondylolisthesis. And this is, again, referring to when the vertebrae slips out of place and can cause pressure on the nerves and the structures like the joints at that level. And usually the pain occurs throughout the day. Arthritis can cause pain on standing and walking. The pain usually is worse in the morning. The patient would complain of stiffness, unable to move in the morning, and it might get better as the day progresses. Osteoporosis that can lead to compression fractures can cause pain on standing and walking, and the pain is usually throughout the day. The piriformis muscle, pain or discomfort in the buttocks that is worse by sitting or standing for prolonged periods of time. Pain that radiates down the back of the leg, similar to sciatica. It can cause numbness or tingling in the buttocks and legs. You can have difficulty walking with range of motion of the hip. These are all signs of piriformis muscle and its syndrome, especially while standing and walking, while you're utilizing that muscle. The sacroiliac joint can cause pain on standing and walking. And remember, that's pain in the lower back or buttocks, worse with standing and walking, but also with sitting. It can be worse with activity, especially bending and twisting at the back. And it can also radiate down the legs, but usually not associated with the numbness and tingling as you do when there's nerve involvement. And the muscles. The muscles can cause pain upon standing and walking. It's usually more of a deep ache instead of a sharp pain. You get spasms and stiffness of the back. It's worse when you move it. And so that's unlike when you have arthritic pain, because that pain usually improves with movement. It's usually alleviated when you rest or change positions. You can have actual tenderness and soreness in that area where the particular muscles are affected. So as you can see, while standing and walking, you may have additional pressures being put on the spine, especially the compressive forces, right? So all the pathologies that we just discussed are caused because a general shear or compressive forces being placed on the spine, putting more pressures on those structures. That's what would cause the pain. Okay, let's continue on with a different pain scenario, this time while sitting. The disc can cause pain in this position, as well as during standing and walking. Pressure onto the disc increases the tendency for the compromises of the structure of the disc to be worse. Increased pressure of the disc happens with gravity and body weight. So any position outside of lying down will potentially worsen discogenic pain. Remember the compressive forces again. Will put pressure on a damaged disc, and could lead to pain because the structure is compromised. So pain from the disc is called discogenic pain again. Spinal stenosis, again, tight spine, right? Cinch in a garden hose, okay? That can cause pain when you have compressive forces onto the spinal canal. So pain on sitting will increase the compressive forces on the spine, and that can cause pain, especially throughout the day. Piriformis pain, while you're sitting, you could direct pressure on the buttock region, and that will put pressure on the piriformis muscle, which will in turn cause pain of the piriform muscle, as well as pressure on the sciatic nerve. One common issue that we see this in is a fat wallet. This occurs especially while sitting for long periods of time, including while driving. Another pressure point when sitting is in the sacroiliac joint. Again, you can have pain in this area, especially when you put additional pressures onto the joint, and the compressive forces while sitting can worsen the SI joint pain. And while sitting, you can put additional pressures in another body part that we didn't really talk about yet, but that's tailbone pain. So the term is called coccydynia, pain in the coccyx. And so you can have actual pain and tenderness in the tailbone region. The pain can be worse on sitting and getting up from a seated position. It's worse with activities that put pressure on the tailbone, such as cycling or horseback riding. Muscle spasms can occur in the buttocks and thighs. You can also have localized numbness and tingling in that area as well. Okay, next lesson. So we're still talking about different pain scenarios. We talk about standing, walking, and sitting. Now let's talk about pain while lifting. So when you're lifting, you're putting that axial load onto the spine that can increase disc pressure. So discogenic pain can occur. The pressure being placed on with axial loading can cause degenerative disc disease to be the source of pain. Spinal stenosis again can cause this additional pain while lifting, and again you're compressing the spinal canal that then will cause pain on the nerves. Osteoporosis, again, while lifting, can be a source of pain. Piriformis, again, while lifting, you can have pain in the buttock region, and again, that's caused by tight muscles while you're lifting, and especially is the piriformis muscle, which can put the pressure onto the nerve. And while lifting, if you have issues with your paraspinal muscles, that can cause a strain in the muscle and cause pain. Okay, continuation of Module 3, pain scenarios. Let's talk in Lesson 4, we're going to talk about pain while bending forwards or backwards. So in bending forwards, let's talk about what happens when you bend forward and when you bend backwards. So when you bend forward, the lumbar spine undergoes what we call flexion, which is the forward bending movement of the spine. During lumbar flexion, the vertebrae in the lower back move closer together, okay, and the angle between the hips and the torso decreases. This movement is controlled by muscles of the back, abdomen, and hip flexors, which work together to bend the spine forward. As the spine flexes, the intervertebral discs between the vertebrae compress and pressure is put on them when they increase. This pressure can be significant, especially when bending over repeated or for prolonged periods of time, and can contribute to disc degeneration and herniation. Additionally, the ligaments and muscles of the lumbar spine are stretched during flexion, and repeated or excessive bending can cause strain or injury to the soft tissue. For this reason, it's important to maintain proper form and technique when bending over and to avoid excessive and repetitive lumbar flexion to prevent injury and promote spinal health. So when you bend forward, remember you're putting pressure in the front side of your spine, and that will then displace the disc and push it towards the back. So a herniated disc can occur. And when the soft material gets pushed just through the angular fibers of the disc, that can place and cause a bulge, if not worse, herniation, which will put pressure on the nerves and cause pain when you're bending forward. Spinal stenosis can be a cause of pain when bending forwards if the stenosis is caused by a disc bulge. Again, if you have osteoporosis, you will cause the wedging effect, and that will put pressure on the front side of your spine, and that can lead to a break or compression fracture. Paraspinal muscles, a deep ache, stiffness of the back, muscle spasms can be worse with movement or activity. And so when you bend forward, you may stretch out some of these compromised muscles and cause pain. What about going backwards now? Well, going backwards is called extension, okay? And that's the backward movement of the spine. While in extension, the vertebrae in the lower back move away from each other, okay? And the angle between the hips and torso increases. The movement is controlled by the muscles of the lower back, the buttocks, and the hip extensors, which all work to try to bend you backward. As you extend, the discs between the vertebrae decompress and the pressure with them decreases. This can provide temporary relief for people that have disc compression or herniations. So bending forwards will make it worse, bending backwards will make it better. However, excessive or repetitive extension can cause strain or injury to the soft tissue of the lower back, including the muscles, ligaments, and joints. This will lead to pain, stiffness, and discomfort in the low back. People with the spine condition, spondylolisthesis, as we discussed, may be advised to avoid lumbar extension because that will actually worsen that condition. Spinal stenosis can also be caused by not the disc, which is when you bend forward, but by ligaments of the back. Okay, the spinal stenosis can cause either forwards or backwards pain. But in this case, if you have a buckling of the ligaments, okay, remember the ligaments that tie one bone to the next bone? The ligaments of the back side of your spine, they tend to will buckle, and when you bend backwards. So when they buckle, it will cause a protrusion into the spinal canal, and that will cause compromise and worsening spinal stenosis. Spondylolisthesis, we talked about this, that as you bend forward, you can have pain from spondylolisthesis. Well, you can have pain when you bend backwards. And again, that's related to the shear forces, the sliding of the bones forwards and backwards. So spondylolisthesis can cause, because there is a slippage, a compromised um, uh, uh, level where spondylolisthesis occurs, will cause additional shear forces to occur because things are not holding it together anymore. And because of that, that will cause pressure on the different structures, including the joints and the disc, and that will cause pain. Ankylosing spondylitis. So we briefly touched upon ankylosing spondylitis, but that is the rheumatological disorder that is one of the rheumatoid arthritis that actually cause pain in the back. And the reason why is because this type of uh, arthritis will cause spine pain and will cause pain and stiffness to occur, because it puts additional pressures on the joints of the spine. Okay, so you will have pain, especially in the morning, but sometimes during the day, because the joints are very compromised, if not fused together in this condition. And just like spinal, uh, the ankylosing spondylitis, the arthritis can put pressure onto compromised joints. And so as you bend backwards, you will put more pressure on the back aspect of your spine, which is where your joints live. And because of that, you can have additional pressures being put onto the spine from bending backwards. And usually osteoarthritic pain occurs, and it's most prominent during morning times. Welcome back to Unlocking the Secrets of Low Back Pain. We're doing Module 4 now. So we kind of understood the general framework of what chronic pain is and what chronic low back pain is. We understood the nuts and bolts, the anatomy, physiology, the pathology. We know when certain pathologies make you hurt. Now we're going to see, what are you going to do about it? How do you go out figuring out what's going on? Well, you do the workup, okay? And the initial beginnings of a workup is, who can you go see about this? So you see a provider. That's number one. Then we're going to go find out if you need to check anything else out, like a lab test, and then also see any pictures that we might see. So we get imaging. And then there's some other tests as well that might shed some light exactly what is going on with you. So there are several types of medical providers that may be involved with the diagnosis and treatment of low back pain. Here are some of the specialists who commonly address this condition. Primary care physicians. Primary care or family medicine is often the first point of contact for patients experiencing low back pain. They can provide the initial evaluation, management, and referral to a specialist if necessary. There's another specialist that you may see, and that's a physical medicine and rehabilitation physician, or physiatry for short. They are specialists that focus on restoration of function and managing pain related to musculoskeletal conditions. They often employ various non-surgical treatments, including medications, physical therapy, and interventional procedures to try to address low back pain. Quite often, you may see a surgeon, a spine surgeon per se. One type of spine surgeon is orthopedic surgery. They specialize in musculoskeletal systems and can diagnose and treat conditions that affect the bones, joints, muscles, and ligaments. They may perform surgeries for certain back conditions, such as herniated disc or spinal stenosis. Another type of spine surgeon is a neurosurgeon. They are specialists that diagnose and treat conditions affecting the nervous system, including the spine. They may be involved in surgical interventions for complex back problems, such as spinal tumors or nerve compression. You may also see another specialist, and that's a specialist in pain management. Their, ex- their expertise is in managing chronic pain conditions. They utilize a multidisciplinary approach, combining medications, interventional procedures, physical therapy, and alternative therapies to help alleviate low back pain. A rheumatologist may also help in diagnosing and treating conditions that affect the joints and connective tissues. Although their focus is primarily in rheumatological diseases, they also may be involved in managing certain back conditions, such as ankylosing spondylitis or inflammatory arthritis, which are rheumatological disorders. So, in lesson two, we're going to be uh, doing another type of test that you may require to really work up the causes and etiologies of the chronic low back pain, and that's to do a lab test. The lab tests are used to determine if there's any ongoing systemic issues or illnesses happening in your body. Let's go over some of them. The blood chemistry panel. So it's also termed a basic metabolic panel. This panel includes tests that evaluate various organ functions and metabolic markers. It can provide insights into conditions such as kidney or liver disease that may contribute to pain. The complete blood count, or in short, CBC. This is a blood test that provides information about the number and the types of blood cells and may help identifying signs of infection or inflammation. The erythrocyte sedimentation rate, or ESR, and the C-reactive protein, the CRP. These are two tests that measure markers of inflammation and may be helpful in assessing conditions associated with systemic inflammation. And systemic inflammations may be attributed to uh, rheumatoid arthritis or certain infections. Blood chemistry panel. Um, we talked about this. Urinalysis. This test examines the urine for presence of abnormalities, including signs of infection or kidney-related issues. Another blood test is the rheumatoid factor and anti-nuclear antibodies, ANA test. These tests help evaluate for autoimmune conditions such as rheumatoid arthritis or lupus, which can cause joint pain. And there's a serum uric acid, which detects elevated levels of uric acid, which can indicate gout, a form of arthritis that's characterized by intense joint pain. Okay, continuing the workup, lesson three, we need to sometimes get pictures of our back to see exactly what is actually going on in there. And the initial step for seeing a provider and then subsequently lab test, um, we want to now get another objective test, and that would be the imaging. The initial imaging that a lot of physicians order is x-rays or plain radiographs. X-rays are commonly the first imaging test performed for back pain. They can help identify fractures, degenerative changes in the spine, and alignment issues. X-rays are particularly useful for evaluating the bony structures of the spine, but it has its limitations. It's just showing the bones, and as you know, there's more than just bones of your low back. there are a lot of ligaments, a lot of soft tissue, including your disc, that don't necessarily be is imaged on x-rays. So a lot of times more further testing besides an x-ray needs to be done to completely get really the full picture of your lumbar spine. Another type is the CT scan. And the CT scan is an x-ray, but it uses computerized processing to help create cross-sectional images of the spine. They are useful in evaluating bone structures, such as spinal fractures or bone abnormalities, and can provide more detailed images of more than X-rays. CAT scans are particularly valuable in assessing the spinal canal, vertebral fractures, or complex bony abnormalities. And let me show you a couple of pictures of what a CAT scan may show. So here are some images that you can see. You can see the one on the left looks much like an X-ray, but it shows a lot more resolution. And using a series of X-rays, the computer can put it together and form an image much like what you see on the right-hand side. And you can see it's a very detailed three-dimensional view of the low back. But as you can see, what it's good at is showing the bones of the spine, okay? But you can't see the disc, you can't see the nerves, and so it still shows part of the picture. So in order to really get and image the soft tissue of the spine, you have to get another type of image, and that's an MRI, magnetic resonance imaging. MRI uses magnetic fields and radio waves to generate detailed images of the soft tissues. This includes disc, nerves, and spinal cord. It can provide information about the herniated disc, spinal stenosis, nerve compression, or the other soft tissue abnormalities of the spine. MRI is particularly helpful in assessing the intervertebral disc and the spinal nerves. And as you can see, now you see the soft tissue, we can see the disc, we can see actually the spinal cord, the contents of the spinal canal, we can actually image herniated discs. So much more detailed and more comprehensive view of the lumbar spine. Now, another question that a lot of patients ask is radiation. Okay, so X-rays do produce radiation. So X-rays and CT scans do emit some radiation. MRIs, on the other hand, uses magnetic fields and radio waves. So there is no radiation involved with magnetic resonance imaging. I wanted to show you two actual machines that are used for an MRI. There are two types in general. The traditional type is the one that's depicted on the lower right-hand corner. And traditional types, much like a cylinder, and where you go through into a tube. The resolution is generally better with these than the other type, which is the open MRI, which is depicted on the upper left-hand corner. In this type of machine, you are sandwiched between the sides, and it's generally open on three sides. These may be more appropriate for people that have concerns with enclosed spaces. The drawback to these images is that the resolution is not as strong as the ones that are in a closed MRI machine. Another imaging test that can be done for the lumbar spine is a bone scan. A bone scan involves injecting a small amount of radioactive material into the bloodstream. This material then accumulates in areas of increased bone activity, such as those affected by infection, tumors, or fractures. Bone scans are helpful in detecting hidden sources of back pain that might not be apparent on the other imaging tests. All right, lesson 4. There's another test that might be available to help work up the functioning of the lumbar spine. Besides the lab tests and the imaging that we already discussed, there is a test called a nerve conduction velocity test, NCV for short, slash electromyography. Generally, these two tests are done together. And what they do is they actually test the function of your nerves, especially coming from the lumbar spine and downwards, or in actually the neck and in the arms. But in our situation, it can test for back nerve related issues. And the way it does it is it measures the speed at which the electrical signals travel through your nerves. During the test, the electrodes are placed over the skin over specific nerve pathways. A mild electrical impulse, a shock basically, is applied to the nerve and the response is recorded. The MCV can then determine if there is any nerve damage, the extent of the damage, and the location of the problem along the nerve pathway. So it can test the function of the nerve, not the actual structure of the nerve, but the function of it. And this is accompanied by an electromyography, EMG for short. And in the EMG component of the test, a small needle is inserted into various muscles along the back and in the legs. The muscles are the end organ of the nerves. It receives all its signal and messaging from the nerves. So, if there's a nerve related issue, you can detect it in the end organ, which is the muscle. And the muscle will pick up either normal signals or abnormal signals. And with the electromyography, you can put that piece of information together with the nerve conduction velocity test and come up with a overall picture of if is any nerve damage in the areas tested. So now we're on to a new module, module 5. And what we're doing is we've now come to the realization about what chronic low back pain is. We found out what is actually our low back is. We have now tried to figure out what is actually causing our pain, how it's causing our pain, and now how do we treat our pain. And we're going to talk about in this module how you can help yourselves in treating this chronic low back pain. Like with all health related issues, the number one thing is taking care of ourselves and making proper lifestyle changes that will help support a good, healthy lifestyle. And this goes with weight loss, having regular exercise, quit smoking, and diet. They all have an impact on pain, especially low back pain. In diet, and what we're talking about is an anti-inflammatory diet. And that's a way of eating that focuses on foods that are thought to help reduce inflammation in the body. Chronic inflammation has been linked to many health problems, including heart disease, cancer, autoimmune disorders. The goal of an anti-inflammatory diet is to help reduce the inflammation by eating foods that have an anti-inflammatory properties and avoid foods that promote inflammation. Here are some foods that are typically included in an anti-inflammatory diet. Fruits and vegetables, okay? Whole grains, lean proteins, and healthy fats, okay? Fruits and vegetables are rich in antioxidants, which can help reduce inflammation, okay? They include berries, leafy greens, tomatoes, peppers. Whole grains, okay, is a great source of fiber, which can help with inflammation. Fiber has many purpose. I feel like our diet in today's society is devoid of fiber. Fiber is extremely important. If there is one thing to change today, after you listen to this lecture, is to help increase your fiber. And there are foods that contain a lot of good fiber. They include brown rice, quinoa, whole wheat bread, But you can also take supplements of fiber. And that's what I usually recommend my patients is to include a supplemental fiber uh, intake. That can be in the form of of a powder, or it could be in a pill. But there are many, many healthy benefits to fiber, let alone helping reduce the inflammation in your body. So another category is lean proteins. Lean proteins can help and build and repair tissues, and it can help then reduce inflammation. Uh, Chicken, fish, legumes, healthy fats, they help reduce inflammation. Nuts, seeds, fatty fish have all healthy fats. On the other hand, we want to avoid and limit the amount of um, pro-inflammatory foods uh, if we want to really promote a healthy way of living. So you try to avoid processed foods, saturated and trans fats, alcohol, and sugary drinks. Okay. Processed foods promote inflammation. They generally have a high amount of sugar, refined carbohydrates, and unhealthy fats, and they all can produce uh, inflammation in our body more than we want. Saturated trans fats are not good. They are foods like red meat, fried foods, baked goods, sugary and alcohol can increase inflammation as well. So make sure you try to limit, if not have a good moderation of these types of foods. It is important to note that an anti inflammatory diet should be part of an overall healthy lifestyle, and this includes regular exercise, stress management, and adequate sleep. When we try to initially treat for low back pain, it usually would include a more conservative type of approach, non surgical, obviously. And the aim is to reduce pain, improve function, and to prevent a, 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 a pressure in our body that will help develop chronic pain more easily. So, how do we do that? Well, rest and activity modifications is important. We want to rest for a short period of time, generally for a few days. That might be helpful, um, but we don't want to prolong the period of rest. Okay, we don't want long-term rest. That's not recommended. Um, you need to engage in low-impact activities such as walking, swimming, cycling that can help the flexibility of the joints, improve muscle tone, and therefore reduce pain. Ice and heat therapy can be helpful. Ice and heat, the general rule of thumb is for the first 48 to 72 hours after an acute onset of pain, you want to use ice. Okay. Um, Ice, and then if the increased pain is longer than 3 days, then you can bring in heat, and heat will help increase blood flow to the area. There is a opportunity to try to alternate cold and heat together. So 20 minutes on, 20 minutes off, and vice versa. I've seen many patients have benefit from switching and alternating ice and heat therapy after 72 hours. Over-the-counter pain relievers, okay, we're going to talk about this in more detail, but non-steroidal anti-inflammatory medications, they're called NSAIDs, such as ibuprofen and naproxen, they can help reduce pain and inflammation. There's many supplements that can help with pain and inflammation. We're going to talk about this in a little bit. Okay, we're on to lesson 2 of self-help. So we talked about some lifestyle changes, some modifications, including diet changes. Let's talk about some medications and supplements that are over the counter. Over-the-counter pain medications are obviously readily available and can be used to help treat the mild to moderate pain. And here are some examples. First one, acetaminophen, Tylenol. Acetaminophen is an effective way to help reduce pain and fever. Acetaminophen does not help with inflammation. Okay, that's to make a note. That's a distinct difference between acetaminophen and NSAIDs, which we'll talk next. It is generally considered safe when used as directed, but beware of excessive doses because acetaminophen can cause liver damage. The general rule of thumb is you do not want to take more than 3 grams of acetaminophen a day. 3 grams equates to 6 500 milligram tablets of acetaminophen Tylenol a day. The common brand name, Tylenol. Panadol is another one. Non-steroidal anti-inflammatories, NSAIDs. So NSAIDs help reduce pain, fever, as well as inflammation. And they do that by blocking the production of certain chemicals in our body. Several examples of this is ibuprofen. It reduces pain, inflammation, fever. The common brand names are Advil and Motrin. Okay. Naproxen, that also relieves pain, inflammation, and swelling. A common brand name is Aleve. Then there's also aspirin that also provides has anti-inflammatory properties as well as help with pain. Common brand name, Bayer, Bufferin. The concern with non-steroidal anti-inflammatories is that it can commonly cause people to have an upset stomach. That's the reason why it's recommended to take these medications with food. And what it can do is reduce the protective layer of your stomach. And given the acidity of the gastric juices, it can then start eroding your stomach lining. That will cause gastric irritation and cause you to have a stomach ache. It can get so bad that you can develop ulcers to the point of having a perforated ulcer, which is basically a hole in your stomach, which is a surgical emergency. So people should avoid taking chronic daily doses of NSAIDs. The other component is it affects your kidneys. So kidney function should be monitored if you're taking non-steroidal anti-inflammatories. So that blood test that we mentioned earlier can help with detecting your kidney function. So that should be alerted to your physician if this is happening. There are also topical analgesics that we can take. They can come in creams, gels, patches that are directly applied to the localized area of pain. Topical non-steroidal anti-inflammatories, they can come in creams or gels like diclofenac. The brand name is Voltaren, or ibuprofen. Lidocaine doesn't help reduce inflammation, but it helps as a local anesthetic, and it numbs the local area. Capsaicin is another form of analgesic. Capsaicin is derived from chili peppers. So it's not a condiment, okay, but it works like chili peppers in that it can help relieve pain after it desensitizes the nerve receptors. The way it does that is it actually starts stimulating the release of this particular substance in your nerve endings, and it depletes it. So it actually burns, okay, that's why chili peppers burn when this substance is released. But then it stays on and it depletes all that substance. So now that burning sensation disappears, and all you have as an aftermath is numbness. There's also a host of combination pain relievers that include a mixture of the ones that we already talked about. examples include acetaminophen with an NSAID. So medications like you see Tylenol with an anti-inflammatory, or Advil with acetaminophen. Those are combination treatments. Sometimes Tylenol is used with caffeine. Caffeine helps enhance the pain relieving effects of acetaminophen, so sometimes that combination is seen as well. Now, we've talked about over-the-counter pain medications. Let's talk about some of the over-the-counter pain supplements. There are several supplements that are commonly used to help reduce inflammation. While the supplements can be helpful, they should not be used as a replacement for a healthy diet and lifestyle. I keep trying to emphasize this. It's always a good idea to consult with a healthcare provider before taking these supplements, because they do interact with some medications and have potential side effects. Let's talk about some of these supplements that are readily available. Glucosamine and chondroitin sulfate. These are supplements that are used to treat joint pain, especially with osteoarthritis. Glucosamine and chondroitin are natural compounds that are found in cartilage, and they may help actually improve, not only as for pain relief, but also help improve joint health. So another compound that is actually used a lot of times in conjunction with glucosamine and chondroitin is MSM. And this is a sulfur-containing compound that has anti-inflammatory properties. So it can help with reducing pain. I take note that this is sulfur-containing because there are people that have sulfa allergies. Another compound that is used is S-adenosine methionine, SAMe for short. This is a naturally found compound that helps reduce pain and inflammation. Turmeric is a naturally occurring spice, and it's derived from curcumin, and which is an anti-inflammatory and pain-relieving supplement. Turmeric supplements are used to treat a whole host of pain and inflammatory conditions like osteoarthritis, but also with menstrual pain. Omega-3 fatty acids, they're found in fatty fish oil supplements, as well as other sources, and have been shown to have an anti-inflammatory effect, as well as a whole host of other healthy benefits. Vitamin D, it plays a role in your immune function. And it also has an anti-inflammatory effect. It is used for a whole host of conditions, as we all know. It's an important supplement. One thing to note with vitamin D is that it can also be naturally produced in our body when we're exposed to sunlight. That's the reason why when we're lacking sunlight, we actually can become low in vitamin D. Ginger. Ginger is used in cooking, right? It also has anti-inflammatory effect, so it's beneficial for a lot of people in pain. Probiotics is the good bacteria in our gut, and so by taking a probiotic supplement, we can help supplement the good bacteria in our gut. It's been shown to have anti-inflammatory effects, as well as a whole host of other health benefits. Quercetin is a flavonoid that's found in foods like onions, apples, berries. It's an antioxidant, and it also has an anti-inflammatory effect. Green tea. Green tea is wonderful. It has an anti-inflammatory effect. So you can drink green tea, or they have green tea extract supplements as well that can be taken. Resveratrol. So resveratrol is a very important compound. It's been found to have many different types of health benefits, but one of the health benefits is has an anti-inflammatory effect. Uh, this is found in wine and in grapes and some berries. Uh, Bromelain. So that's an enzyme that's found in pineapples, and pineapples have been found to have an anti-inflammatory effect. Vitamin C, obviously, very important for a multitude of things, but it's a potent antioxidant that can help reduce inflammation. Uh, Obviously, vitamin C is found in many fruits as well as some vegetables, but it can be taken as a supplement. Magnesium is an important mineral that is integral to many of our processes in our body, and that has been shown to have an anti-inflammatory effect as well. Foods like spinach, almonds, and black beans is rich in magnesium. Zinc is another mineral that's very important for our immune function. It has an anti-inflammatory effect. Oysters, beef, pumpkin seeds all have a high volume of zinc, but there are supplements as well. Again, it's important to remember supplements are not regulated in the same way that prescription medications are. So it's important to try to choose high quality products from reputable brands. It's a good idea to talk to a healthcare provider before starting any new supplement regimen. Okay, we're continuing on with our self help for our chronic back pain. Let's talk about a home exercise program. So before we talk about the particular exercises that you can do at home, let's talk about the phases of rehabilitation. How do we heal and get ourselves better using exercise? Well, it's important to understand the phases, okay? The phases should be followed in order. Phase 1 being pain control. Phase 2 is stretching. Phase 3 is strengthening. We have to follow it in sequence. If we are out of order, suppose we start lifting weights to help strengthen our back before you are adequately have enough pain control, or you didn't properly stretch, well, you're going to perhaps injure yourself and also cause yourself to be back to phase 1, which is pain. So we have to follow it in sequence in order to develop and grow our bodies to be stronger. Pain control phase, that's the goal is to help control and manage the pain adequately, especially inflammation. We're not talking about zero pain. We're not talking about, getting all the pain rid of before you start the rehabilitation process. It's about managing it, having a better grasp of the pain. So that needs to be accomplished before you go into the second phase, which is stretching. And in stretching, the goal is to help improve the flexibility, to restore the range of motion, and prevent muscle imbalances. So you have to properly stretch your joints so they have proper range of motion before you start strengthening it. And that's phase 3. And when you strengthen, you're trying to focus on improving the muscle strength, the endurance, and the stability of your back. And so um, when you start strengthening, you're going to hopefully try to achieve the goal of improved functionality. That's the ultimate goal with this whole process. And with this process, you're going to notice that sometimes you're going to get yourself to such a higher level of function that you haven't achieved before that you're going to do too much. And which is the goal. But unfortunately, if you do too much, that might set you back because that might cause more additional pain. So then you're going to go back into pain control first, and then stretching, then strengthening in that order. So sometimes this rehabilitation process is much like taking 2 steps forwards, hopefully 3 steps forward, and then 1 step back. And it's an ongoing process that will be essentially forever, because we can always challenge ourselves to do better. So exercise obviously can be a very effective way to help uh, manage and reduce low back pain. And here's a few exercises you can take home and do. The cat-cow stretch, okay? So get on your hands and knees, and with your hands shoulder width apart and your hips hip width apart, you're gonna arch your back and inhale. This, at the same time, you're gonna bring your head and tailbone towards the ceiling. So that's the cat position. And then when you exhale and round your back, you're gonna bring your head and tailbone toward the floor. So then that's the cow position. And you're gonna repeat this for 30 seconds to 1 minute. Hamstring stretch. So several ways of doing this. You can be in the upright position like the gentleman in the video, or you can lie on your back with your knees bent and feet on the floor. And you're going to bring one knee towards your chest, okay? And you're going to grasp behind your thigh with both hands, and you're going to straighten out your knee, keeping your foot flexed until you feel that stretch in the back of your thigh. Okay, try to hold it for 15-30 seconds, and then you're going to repeat on the other side. The pelvic tilt. So in this, you're going to lie on your back with your knees bent, feet on the floor. You're going to flatten your back against the floor by tightening your abdominal muscles and pressing your lower back into the floor. Okay, you're going to try to hold it for 5 to 10 seconds and then relax. The bird dog. So with the bird dog, you're going to get on your hands and knees, and with your hands shoulder width apart and your knees hip width apart, you're going to tighten your abdominal muscles. You're going to then lift one arm and the opposite leg off the ground. You're going to try to keep them straight. You're going to try to hold that position for 5 to 10 seconds, and then you switch sides. The bridge. So lie on your back with your knees bent, feet on the floor. You're going to try to tighten your glute muscles and lift your hips off the floor until your knees, hips, and shoulders are in a straight line. You're going to try to hold that line for 5 to 10 seconds, and then you're going to lower your hips back onto the floor. The cobra stretch, okay? So lie on your stomach with your hands under your shoulders. You're going to press your hands into the ground and lift your chest up. This, while you're keeping your elbows close to your body, you're going to then hold that for a few seconds, and then you're going to lower back down. Exercise ball. So an exercise ball is a worthwhile investment for your home. Okay, there's a multitude of ways to use it. Okay, the first stretch and exercise I would recommend is just to lay on it on your back, and you can roll back and forth. Okay, that will help stretch your back out in extension. Then you're gonna turn around and lay on your stomach. Okay, and then you're gonna roll back and forth on that too. That will help with flexion. Okay, and then after you stretched out, a form of strengthening exercise you can do on the exercise ball is then you're gonna try to pick yourself up. Okay, so while you're lying on your stomach, you're gonna pick yourself up and try to arch your back. Okay, that will work the spine extensors. Okay, and vice versa, if you're on your back, you're going to try to pick yourself up, and then you're going to be working your abs. In the seated position, there's a lot of people that actually use an exercise ball instead of a chair. And when you sit on it, you're going to start using some of the postural muscles of your back, okay, in the seated position. So it will take no time away from your work, okay, while you're actually exercising. So that's a great way to utilize this exercise ball. Another form of equipment that you could bring home is an inversion table. An inversion table is a piece of equipment that allows you to hang all the way upside down if you want. but I recommend that you just uh, start at an inverted angle, so negative degrees, okay, 5-10 degrees to begin with. And what it does is it actually starts distracting your back, okay, so it decompresses the spine, okay, with gravity. So now you're going to have your body weight pull with gravity and distract your spine. Okay, that will help alleviate some pressure from the disc and the nerves in your lumbar spine. Okay, and what I generally recommend for patients is you just start at 5 to 10 degrees in the decline position, and you're going to stay there for maybe 10-15 seconds, and then you're going to stop. Okay, there are pros and cons, benefits, and potential side effects from using an inversion table that I'll talk about next. Benefits. So, like we talked about, it decompresses the spine. So, if you start distracting the spine, you're gonna cause negative pressure in the disc, and the pressure on the nerves will relieve because there's more room. Okay. Not only that, but having an inversion table is good for people without actually even low back pain because it helps improve circulation. It improves blood flow to the brain and upper body. It helps relieve muscle tension. Okay, so it helps stretch with gravity. Um, but there are some issues with inversion table that I warn my patients about, and that's that because it does increase blood flow into the brain, it can cause too much pressure in the brain. So inversion, especially too much at too negative of degrees, will cause blood to rush into your head, and that can cause headaches, dizziness. Um, it also can increase the pressure in your head, including your eyes. So that can cause pressure in your eyes. So people with glaucoma that already has an issue with uh, intraocular pressure will have worsening issues. So be wary of people that have glaucoma. We're on to module 6. So we talked about trying to help ourselves with our low back pain. Now let's talk about treatments for chronic low back pain utilizing other providers, so specialty care. There's many other providers that can help patients with chronic low back pain. There's a combination of strategies that can be used to help improve mobility and address underlying pathology or the contributing factors. Um, Chiropractic, physiotherapy, acupuncture, massage, and psychological counseling are some that I wanted to discuss with you. For chiropractic care, is a form of conservative treatment, okay, that focuses on diagnosis, treatment, prevention of mechanical disorders of the musculoskeletal system, especially the spine. They use a multitude of techniques, but the primary form is to help manipulate the spine using manual techniques. Spinal manipulation, also known as a chiropractic adjustment, is a core treatment method used by chiropractors. What it involves is applying controlled force to joints of the spine and other areas of the body to help improve alignment, mobility, and function. The goal of spinal manipulation is to reduce pain, improve spine function, and alleviate pressure on the nerves. Chiropractors can perform individualized assessments and diagnoses. Spine manipulation is used, like I said. That is then this individualized approach is nice because it will be unique to yourself, and they can help tailor a treatment plan for the specific needs of each patient. They also work you up, okay? They also have a proper medical history. They perform a physical examination. They can also request imaging tests. Manual therapies are involved. There's various types that includes soft tissue therapies such as massage, myofascial release, stretching techniques to reduce muscle tension, and it also improves flexibility. Um, Besides chiropractic therapy, there's another form of uh, of therapy, and that's physical therapy. And the overall goal of physical therapy is to help improve strength, flexibility, posture. It can promote overall well-being. The physical therapy modalities are non-invasive, um, and they help improve function by targeting the specific tissues or nerves. Some modalities are used is heat therapy. So applying heat to an affected area can increase blood flow, reduce muscle tension, and promote relaxation. Um, Heat can be applied using hot packs, warm towels, heating pads, and on the contrary, cold therapy can be used. So by applying cold to an affected area, that can help reduce inflammation, swelling, and pain. Cold can be applied using ice packs, cold towels, cooling sprays. Electrical stimulation can be employed. That uses low level electrical impulses and it targets specific nerves and muscles. It can help reduce pain and muscle function. There are two types of electrical stimulation. One is transcutaneous electrical nerve stimulation, in short, called TENS. And then there is also neuromuscular electrical stimulation. Ultrasound therapy. Ultrasound uses high frequency sound waves to penetrate deep into the tissues. It can help promote healing and reducing pain. It, it uses the high frequency sound waves that actually eventually produce heat. Manual therapy, much like chiropractors, they involve techniques such as massage and joint mobilization and reduce pain and improve mobility. And the other modality that physical therapy is known for is exercise therapy. So it involves specific exercises that are designed to help improve strength, flexibility, range of motion, reduce pain, and to help ultimately prevent further injury. Traction is used. Traction involves the application of gentle pulling forces on the spine or extremities. That will then reduce pressure on the nerves and reduce pain. Acupuncture is another specialty care provider that can help with chronic low back pain. This involves the insertion of thin needles into specific points of the body, and the whole point is to help promote this their theory of improving the flow of energy or qi, and that may help promote healing. Um, One theory that we have about acupuncture is that it stimulates the release of endorphins, which are your own body's natural pain relieving chemicals. And acupuncture may also help reduce inflammation, improve blood flow, stimulate the nervous system. Outside of needling, acupuncturists sometimes utilize herbal medicine, uh, techniques like cupping and moxibustion. Massage. So we all know massage, but there are many forms of massage, and each one has its own uniqueness in how it can approach chronic low back pain. Swedish massage. That's a gentle, relaxing massage that uses long strokes, needing circular movements to help reduce the muscle tension, and it helps improve circulation. Deep tissue massage is more intense, and that tries to target the deeper layers of the muscle and connective tissue, and it tries to relieve that muscle tension. Trigger point massage, that involves a massage that targets specific points of muscle that is causing pain, and pressure is applied and then released to help alleviate the pain and tension. Myofascial release is a massage that focuses on the connective tissue that surrounds and supports the muscles and organs and helps release the tension and pain that way. Shiatsu massage, that's a Japanese massage technique that uses finger pressure on certain points of the body to help alleviate the pain and tension. Thai massage is a massage that combines stretching and massage techniques to help relieve the tension and improve flexibility. And hot stone massage uses heated stones to warm or relax the muscles to allow for other forms of massage therapy to take place and maybe provided the massage to penetrate into the deeper layers. And sports massage is a technique that focuses on specific muscles um, that are used in athletic activities to help improve range of motion and reduce the risk of injury. Um, Lastly, psychological counseling. Psychological counseling is a very effective approach to managing chronic pain. It addresses the emotional and psychological factors that can influence the perception of pain and a person's overall well-being. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach for chronic pain. It focuses on identifying and changing the negative thought patterns and beliefs that are related to pain, as well as developing coping strategies and behavioral changes. CBT helps individuals better understand the connections between their thoughts, emotions, behaviors, and pain experiences. This leads to improved pain management and quality of life. Um, the pain education and psychoeducation, it provides individuals with the information and knowledge about chronic pain. It teaches about the underlying causes, mechanisms, and treatment options. By better understanding their condition, it helps reduce fear and anxiety related to pain, and it promotes self-management skills. There's relaxation techniques and stress management. Um, these techniques are used to help relieve chronic pain by teaching relaxation techniques such as deep breathing, progressive muscle relaxation, mindfulness meditation, and guided imagery. Coping skills training. Um, this may involve identifying and modifying the unhelpful behaviors. It helps with problem solving, goal setting, and helping improve communication skills. By teaching people these skills, it will help them empower themselves, okay, to actively participate in their pain management. And emotion regulation and mood management. Chronic pain leads to emotional distress. This includes depression, anxiety, frustration. Um, the psychological counseling helps improve individuals' ability to regulate their emotions, to manage the fluctuations in mood, and that will develop into healthy coping mechanisms to enhance their well-being. Supportive counseling. So ongoing supportive counseling is very important. It provides a space for individuals, a safe space, and where they can express their feelings, concerns, and frustrations. It focuses on empathy. It validates their concerns. It provides emotional support. So that is therapy in itself, and it helps individuals better cope with their pain. Okay, treatments for chronic low back pain. Let's talk about medications, specifically prescription medications. So there are many types of medications used for chronic low back pain. Um, this is some of the list: anti-inflammatories, muscle relaxants, non-opioid pain medications, and opioid pain medications, uh, neuroleptics, and antidepressants. Let's talk about opioid medications, okay? They are very commonly used for pain relief, but they have a wide range of side effects. This includes constipation, nausea and vomiting, drowsiness. These are more of the commonly known side effects for opiates. Okay, opiates can slow down the digestive system. This causes constipation. It can cause nausea and vomiting, drowsiness. It causes possible sedation, which can affect your ability to drive or operate machinery. It can cause respiratory depression. It can slow down your breathing, and in high doses, when combined with other medications, it can cause respiratory depression, and that can be life-threatening. Dizziness. It can cause dizziness, lightheadedness, itching, especially in the face and neck. It can cause hormonal effects. We're going to talk about that in detail. That's something that's a little less known about the side effects of opiates. It can cause confusion, okay, especially in the older adults. And you can develop tolerance and dependence on opiates. That means that higher doses of medications are needed to achieve the same effect over time, and dependence can develop. This means that the body becomes reliant on a medication to function. Opiates can affect hormones in the body. This is in particular to two pathways in our brain and in our organs: the hypothalamic pituitary adrenal axis and the hypothalamic pituitary gonadal axis. The HPA axis is responsible for regulating the body's response to stress. And opiates can disrupt the system by decreasing the release of the stress hormone cortisol. This can lead to decrease in immune function, bone density, and muscle mass. The other axis, the HPG axis, is responsible for regulating sex hormone production. And opiates can disrupt this system by decreasing the release of luteinizing hormone, LH, and follicle stimulating hormone, FSH. These can lead to a decrease in sex hormone production, including testosterone and estrogen, and can cause changes in sex drive, menstrual periods, and fertility even. In men, long-term opioid use can cause decreased testosterone levels, leading to decreased libido, erectile dysfunction, and decreased muscle mass. In women, long-term opioid use can cause changes in menstrual periods and fertility. This may be dangerous, as it can lead to potential life-threatening adrenal crisis. It can be treated for patients who must continue opioid therapies, but it can be clinically managed very judiciously. But sometimes it is difficult to manage. So it is best to stay away from it. The weaning process of opiates, if we need to do that to avoid some of these other side effects, must be done slowly. Okay, and generally the dosage of medications is reduced over time, allowing the body to adjust to a lower dose and minimize the withdrawal symptoms. The length of the weaning process can vary depending on the individual's level of dependence, the type of medication, and the length of time the medication has been taken. But in general, you want to see a graph like this in the gradual reduction of the dosage of the medication. Decreasing the doses by a certain percentage at regular intervals is the safest way to titrate someone off medications. Another way that patients can be weaned off of medications is to use other medications. So we can do medication-assisted treatment, MAT for short. But there are a few ways to perform this. One medication is used is called buprenorphine, and that's a medication that's given, and it's tapered over time with this oral medication. Another medication is methadone, which is also tapered over time with oral medication. Another way that is done more quickly is called rapid detoxification. And what we do is you actually administer an opiate antagonist, so medication that completely repels the opiates. And it's administered while a patient is actually sedated and unconscious with active anesthesia on board. Again, these are not without its own side effects and potential complications. Other medications that are used that are prescribed are anti-inflammatories. We talked about anti-inflammatories that are over the counter. There are also prescription anti-inflammatories, but again, anti-inflammatories help reduce pain, inflammation, and fever. Okay, the common ones are aspirin, ibuprofen, and naproxen. Okay, but they do potentially have side effects, as we mentioned. Your stomach can get upset, cause nausea, vomiting, diarrhea. Stomach ulcers can develop. Bleeding in the digestive tract can happen. Kidney damage can happen. Increased risk of heart attack or stroke, especially when you're on long-term or high doses of these medications. And it can obviously have allergic reactions that causes rashes and hives and difficulty breathing. NSAIDs can interact with other medications. They can interact with other blood thinners, steroids and antidepressants. Just make sure that if you are taking these medications that a physician is properly monitoring the prescription. Muscle relaxers are used for pain relief, but side effects include drowsiness and dizziness. So it's difficult to drive or operate heavy machinery on muscle relaxers. It can cause dry mouth, blurry vision, difficulty urinating. It can cause muscle weakness, increased risk of falls, especially in the elderly. Dependency and withdrawal symptoms occur, okay, just like with opiate medications. Non-opioid pain medications can cause GI side effects, headache, dizziness, drowsiness, liver kidney damage with long-term use, increased risk of bleeding, especially people that are already on blood thinners, and cause allergic reactions. Neuroleptics. Neuroleptics are medications that treat the nerves, and they have potential side effects. They produce side effects such as muscle stiffness, tremors, and involuntary movements. We call them EPS. That's extrapyramidal symptoms. Sedation, drowsiness, and dizziness can occur. Weight gain, metabolic changes, which can cause further issues with other conditions such as diabetes and heart disease. There is a potential life-threatening complication, and that's called neuroleptic malignant syndrome. That particular issue and condition is actually very rare, but it does happen. And in every surgical center, it's a rule and a law that we must have the antidote to neuroleptic malignant syndrome on board, because it is such a grave, life-threatening reaction that can happen. Antidepressants, Well, antidepressants can cause issues. It can cause sexual dysfunction, so it decreases libido. It's difficult to achieve orgasm or an erection. It can cause weight gain and metabolic changes. So it can worsen diabetes and heart disease. It can cause sleep disturbances, increased risk of actually suicidal thoughts and behavior. And there is another life-threatening potential complication, and that's called serotonin syndrome. And that can lead to increased confusion, agitation, rapid heart rate, and high blood pressure. Okay, let's talk about more treatments for chronic low back pain. And specifically in lesson 3, we're going to talk about interventional procedures. Interventional pain means minimally invasive procedures that help reduce pain and improve function by targeting specific structures or nerves in the low back. And here are some of the common types of treatments. Trigger point injections. Uh, Trigger point injections is a medical procedure used to help alleviate pain and discomfort caused by trigger points. Trigger points are tight, tender knots in the muscles that can cause localized pain as well as referred pain to other areas of the body. Uh, Trigger point injection involves the injection of medication such as a local anesthetic or a combination of anesthetic with a corticosteroid, and it's directly injected into these areas to help alleviate the pain and promote muscle relaxation. The theory behind trigger point injections is based on a concept that trigger points in a role in causing pain and discomfort in the muscles. Trigger points are hyper irritable spots within a muscle that are palpable and they feel like tight knots or nodules. They can develop due to a variety of factors, including muscle overuse, trauma, poor posture, stress. But here in the diagrams, we show some common patterns of what trigger points can cause. So um, in the bottom, we see even in the piriformis muscle in the buttocks that it can cause referred pain that goes all the way down the leg. And trigger points in the low back can cause pain that radiates down the leg. An epidural steroid injection is a medical procedure that involves the injection of corticosteroid medication into the epidural space. And it can help, the goal of the procedure is to help reduce inflammation and alleviate pain that's caused by nerve irritation or compression in the spinal region. Epidural steroid injections are commonly used to manage pain associated with conditions like herniated disc, spinal stenosis, radiculopathy. Facet joint injection. So we can actually inject directly into the facet joints. We can utilize a local anesthetic and a corticosteroid, and that can help alleviate pain caused by the inflammation and the arthritis of the joint. Another technique to help alleviate pain from the facet joints is radiofrequency ablation. Radiofrequency energy is used to help destroy the nerve fibers that transmit the pain signals from the facet joints. And by doing that, we will eliminate the sensory nerves of the facet joints. Now, the nerves regenerate, so it's not forever, but it provides a longer lasting relief because it takes a while, 6 months to maybe 2 years, for the nerves to help regenerate. Spinal cord stimulation is another technique. That's when we utilize a implanted device that sends electrical signals to block the actual pain signal that goes to your brain. So spinal cord stimulation is much like a pacemaker for the spine, and it interrupts that nerve signal with another electrical signal. Intrathecal pain pump. So we can actually deliver medication directly into the spinal canal and the spinal cord. By utilizing this technique, we can actually uh, reduce the amount of pain medication a patient receives by multifold. By doing that, we can hopefully eliminate a lot of the side effects from the pain medications. There's another field of medicine which is utilized in interventional pain, and that's regenerative medicine. Regenerative medicine is a branch of medicine that aims to restore, replace, or regenerate damaged or diseased cells, tissues, or organs utilizing a variety of techniques, including stem cell therapy, tissue engineering, and gene therapy. The goal of regenerative medicine is to find new ways to treat or even cure diseases and injuries that currently have no effective treatments. One of the key approaches in regenerative medicine is to use stem cells, which are undifferentiated cells that have the ability to differentiate into various type cells and can potentially be used to replace damaged or lost tissue. Stem cells can be derived from a variety of sources. This includes embryonic tissue, adult tissue, induced pluripotent stem cells, which are generated by reprogramming adult cells back to a pluripotent state. So we can basically grow specialized cells from a cell that doesn't already have a imprinted code to a certain tissue. There's several current treatments with regenerative medicine that can help treat for chronic back pain. This includes platelet-rich plasma, PRP for short. This is a procedure that involves injecting a concentrated solution of platelets, growth factors, and other healing factors that's actually derived from the own patient's blood. And it's injected into an affected area to promote tissue regeneration and to reduce inflammation. Then there's stem cell therapy. That's a procedure that involves injecting actual stem cells that have the ability to differentiate into other various cell types to help promote tissue regeneration and repair. And there's prolotherapy. Prolotherapy is a procedure that involves injecting actually a solution of dextrose or other substances into an affected area. And the goal is to help stimulate your own body's natural healing response to promote tissue regeneration. So, this is the last module and the last lesson of our course. Uh, This is a topic which we um, need to address that we are striving not to have, and that's surgical um, intervention. Surgery, well, in severe cases, surgery may be necessary to address the underlying structural abnormalities, such as herniated disc and spinal stenosis. Um, there are types of spine surgeries. Um, Decompression, which comes in several forms, discectomies, spinal fusion, artificial disc replacement, intervertebral spacers, vertebroplasty or kyphoplasties. In decompression surgeries, um, there are different versions of it: forainotomy, laminotomy, laminectomy. Um, there are procedures that will remove bone or tissue that is compressing on the nerve root as it exits the spinal column through a tiny bony tunnel called foramen. So this can be performed to treat conditions such as herniated disc, spinal stenosis, or degenerative disc disease. But basically, you're removing a piece of bone. Um, the different forms of decompression is determined by how much bone and where the bone is removed. Discectomy is a surgical procedure to help remove a portion of the herniated disc that is pressing on the nerve root or the spinal cord, which causes the back pain and other symptoms. So basically shaving a piece of the disc off. Spinal fusion. So that's a procedure that involves fusing two or more vertebrae together, and that helps stabilize the spine and prevent movement that causes pain or nerve damage. There are many different types of spinal fusion. There's anterior fusions, which is depicted in the lower right-hand corner, and on the picture above, that's a posterior fusion, meaning it's coming from the back. Artificial disc replacement. That's a procedure that involves removing damaged or degenerative disc and replacing it with an artificial disc. It can help restore motion and relieve pain. Intervertebral spacer or interbody cage. These are there's many various devices that are used. They are intended to help restore height and stability of the disc space between the vertebrae. They're often used alongside with spinal fusion or disc replacement surgeries to promote fusion and provide support to the spine. And then there's vertebroplasty and kyphoplasty, procedures used to treat vertebral compression fractures caused by trauma, osteoporosis, or cancer. Vertebroplasty involves injecting some bone cement into the fractured vertebrae to help stabilize it. A kyphoplasty is when you actually insert a balloon in the vertebral body, and it helps restore the height before injecting the cement in.